recommendations to minimize the risk of COVID-19 transmission. In the following video, we're going to learn how the COVID-19 virus are transmitted, what factors lead to a greater or lesser possibility of infection, and how we can evaluate the risk we face in each case according to the documentation. General recommendations to minimize the risk of COVID-19 transmission in the tourism sector in Latin America and the Caribbean. How is COVID-19 transmitted? The virus is transmitted three ways: transmission by aerosols, exhaled by infected people and inhaled by other people. It enters the lungs directly. Aerosol infection is not always immediate, since aerosols can be suspended in the air in poorly ventilated closed spaces. We can enter a room in which we are alone, but if it has been previously occupied, we could become infected. Aerosols are diluted by drafts, which is why ventilation is so important. Transmission by droplets expelled by infected people that reach the mucous membranes of other people. They generally reach a maximum distance of 2 meters. But if the person shouts, sings, or engages in high-intensity physical exercise, the droplets could reach greater distances. Transmission by this route is immediate. Transmission by contact with contaminated surfaces occurs when a person touches a surface on which a droplet from an infected person has landed and puts their hand in their mouth, nose, or eyes. Experts point out that, as with other respiratory diseases, aerosol transmission is the most frequent route of virus transmission. Transmission via contact with surfaces is not as common as thought, because many conditions must be met for an infected particle to be deposited on a surface with an active virus with a sufficient viral load to enter our body. What factors influence virus transmission? The transmission risk is not always the same. It varies depending on the following factors: ventilation, safety distance, face mask use, exposure time, relative humidity. Each of these factors affects the probability of contagion from one or more transmission routes. Ventilation. Ventilation reduces airborne transmission because air currents dilute aerosols, which is why it is so important to stay outdoors whenever possible. In indoor spaces, the air must be constantly renewed so that aerosols do not remain floating in the air, where they can be inhaled by other people. It is important to extract dirty air and introduce clean air through natural ventilation, that is, opening doors and windows in indoor spaces. Mechanical ventilation, for example, air conditioning, or combining both if necessary. Not all mechanical ventilation systems are equally efficient, nor do all spaces have the same characteristics or occupancy levels. If it is not known if the ventilation available is sufficient, it is necessary to measure the level of CO2 in the air. If the result is above 800 parts per million, it is necessary to reduce the space's capacity or increase the air renewal frequency and recheck the CO2 level. At least 5 complete airspace changes per hour are considered adequate. Safety distance. Keeping a safety distance helps us protect ourselves against infection via droplets and aerosols from other people nearby. Therefore, the greater the safety distance, the lower the risk of contagion. However, in closed spaces, safety distance is not sufficient to prevent infection from aerosols because it does not protect us from those particles suspended in the air for hours. Face mask use. Face mask use protects against infection by droplets with infected particles. Face masks create a protective barrier in situations when it is impossible to maintain the safety distance. In addition, in closed spaces, face masks protect you from the possible inhalation of aerosols with infected particles suspended in the air. Finally, acting as a barrier to the droplets that we expel, it prevents them from being deposited on surfaces that other people can subsequently touch. Not all face masks protect equally, so you should choose the most appropriate for each situation. In confined spaces, the FFP2, K95, or N95 type face mask is recommended. Properly adjusted, they offer better protection against the inhalation of aerosols than surgical or hygienic masks. Face masks with a breathing valve are discouraged since they do not filter possible infected particles from the carrier, thereby putting other people at risk. Exposure time. The more time we spend near infected people or in spaces that have recently been occupied by them, the more likely we are to contract the virus. As we generally do not know if they are asymptomatic infected people in our environment, it is necessary to reduce the time we spend around other people and in poorly ventilated spaces that have been recently occupied. Therefore, to reduce the transmission risk, it may be necessary to move activities outdoors, digitize processes, reorganize the way spaces are used, etc. Relative humidity. Although it can only be controlled indoors, keeping the relative humidity between 40 and 60% reduces the risk of transmission. Dry environments, for example, less than 40%, favor the suspension of aerosols in the air in poorly ventilated spaces. In humid environments, for example, greater than 60% RH, viruses, bacteria, and other pathogens proliferate. In addition to the previous 5 factors, some basic hygiene guidelines, including hand washing hygiene, respiratory etiquette, and avoiding touching your nose, eyes, and mouth, reduce the possibility of infection. How do we assess transmission risk? The combination of all of the above factors implies not all spaces and activities carry the same risk. That is why it is important to know the level of risk in each situation, high, medium, low, and to adjust the preventive measures in each case. Thus, the lowest risk situation would occur outdoors when we are alone or maintain the safety distance from other people, wearing a face mask, and for a short period. On the other hand, there would be a medium risk in an indoor space without a mask, even if it is well ventilated. Lastly, indoor spaces with poor ventilation, in which people remain without a face mask for more than 15 minutes, carries a high risk. There is a matrix prepared by a group of scientists which combines the factors that we have just reviewed and helps us to visualize the situations in which there is a higher transmission risk. It is useful to understand when it is necessary to implement prevention actions. In the following videos, you will see practical risk assessment examples applied to different establishments and tourist spots. Based on the result of the risk assessment, high, medium, low risk, a set of recommendations can be implemented to minimize the transmission risk. Remember that zero risk doesn't exist, and it is up to us to adopt the necessary preventive measures to end the virus spreading. To find out complete recommendations to minimize the risk of COVID-19 transmission in the Latin America and the Caribbean tourism sector, visit www.iadb.org/tourism protocols.